I'm Dr. Chuck Murphy. I'm here at the Inova Heart Recovery Symposium, and I'm joined by Dr. Lynn Morris from Philadelphia. Dr. Morris, I'd love to get your thoughts about how mechanical circulatory support has really been a game changer in the field of cardiology.
I think that we've had mechanical circulatory support for quite a few years. It's been predominantly surgically driven. What we've seen in the last decade or so is the ability to provide that same circulatory support percutaneously, much less invasively. And I think it's changed the paradigm for the way we approach people with shock and complex coronary artery disease, which is a real problem in the United States. So being able to place a device percutaneously without having to open the chest has allowed people to get the benefits of circulatory support without a lot of the adverse events.
When you were talking earlier, it also allows the cardiologist to really do a better job at getting full revascularization.
I think the role of the surgeon has always been very important. They've been able to get complete revascularization or complete cleaning out the arteries much better than cardiologists in the past because they have bypass surgery. Now with percutaneous support and the new mechanical support devices, we can get the same support and have the same luxury of getting complete revascularization, more complete, more aggressive revascularization, while mitigating a lot of the risk of the old PCI procedure.
Then the other thing, I'd like to switch into cardiogenic shock because unfortunately about 50% of patients with cardiogenic shock die. Is sort of the historical data, but it seems to me that maybe we're seeing a paradigm shift with the survival and the outcomes in that field as well. Comments on that?
Yes, I think that we've seen two impacts on cardiogenic shock. The person who has the low blood pressure, low heart output, who are really in big trouble. The mortality rate ran about 85% for years before we learned to open totally closed vessels. With opening the totally blocked vessels, we were able to get the mortality rate down to 50%. But over the last decade, we have not consistently broken that 50% mark. And I think what we've found with a lot of effort around the United States and around the world is that placing the percutaneous support device earlier in the people with shock, we're actually seeing a further improvement in survival. I think that's a true paradigm shift. We finally have the chance to break that 50% mortality rate, and that would be a dramatic improvement in cardiac care in this country.
And then the last thing I'd like you to touch on for us is that, you know, the patient really who, with these support devices, we can limit to single system disease, meaning their heart doesn't work. Could you comment on sort of how things have advanced in terms of us being able to really give those patients a quality of life with current technology?
Well, I think one thing that we've learned with the percutaneous support devices is that we can not just save the life of the patient, get them to transplant or a left ventricular assist device, but a lot of times with the new devices, we can provide heart recovery. And instead of going home with a piece of metal or somebody else's heart, we're able to recover their heart to the point that they can go home with their own heart, work with advanced heart failure doctors to try to improve their quality of life without having gone through a transplant or an implantable device. That is probably our ultimate goal. Yes, transplant's fantastic. Left ventricular assist devices have been fantastic. But if we can support people recover their heart and keep their heart, that's really a true paradigm shift.
Thank you very much, Dr. Morris.
Thank you, Chuck.